I'm Dr. Buck,
And I'm Dr. Jones.
and we are both residents at the family medicine program in Durant.
We're going to talk today about what it takes to become a doctor.
So hopefully some of you guys are interested in becoming physicians eventually. We obviously think it's a great idea.
It's the best job ever. Some of the requirements that it takes to become a doctor is the first step is to graduate 8th grade.
I think that's a good first step, Dr. Jones. And then, of course, you're going to move on to high school, and that's a big step in your life, too, is graduating from high school. And then if you're planning on going to medical school, your next step is going to be going to college somewhere, getting a bachelor's degree or a 4-year degree of some sort, getting your prerequisites for medical school. And then while you're in college, you'll take the MCAT, which is, I will admit, not a very fun exam, but it's an entrance exam for medical school.
After you take the MCAT and you have all your stuff done, you're going to apply to all these different schools. There's tons of schools throughout the United States, and there's MD schools and there's DO schools. So there's lots of different options when going down the route to become a physician. So you'll apply, and then medical school is 4 years. In that 4 years, the first 2 years are in the classroom, and the last 2 years are in the hospital and in the clinics.
So while you're in medical school, you'll be taking a ton of exams, and you'll have board certification exams that you'll have to take as well throughout. And then once you're done with medical school, you'll move on to a residency program, which is what we are doing right now. And those are at least 3 years or more, depending on what specialty you choose.
So after you go through all of those steps, you can start to talk about how much money a doctor might make. And since there are so many different specialties and different ranges of qualifications and skills, it's really hard to put a number on that. But base salary is about $200,000 a year for a physician.
And that'll also vary with what specialty you choose to go into.
And where you want to practice.
Right, exactly. So, then probably your next question is going to be, how much are you working during the week? Or how much are you working during the day? So just like everything else we've talked about, that can vary as well. So I know that Dr. Jones and I personally can work up to 80 hours a week in our residency program. People that predominantly work in clinics may work from 8 a.m. to 5 p.m. Most hospital shifts are 12-hour shifts. So if you're in the ER or you're seeing patients in the hospital or doing really anything inside the hospital, you'll be at work for about 12 hours a day.
You might wonder what we do in a 12-hour day, because that's a long day.
Yeah, but we do a lot of things during the day.
We do. We usually start off first by seeing every patient that we're responsible for. So we check in, make sure their medications are good, they're doing well, they're eating well, they're breathing well, all the things that are important when taking care of somebody. And then if anything needs to be taken care of, like a procedure, we would spend our time taking care of the patient, either putting in chest tubes, doing central lines. If a patient comes in and their heart has stopped, we do CPR. We do intubations where we put a tube down their throat and have them breathe from a ventilator. And then a lot of time is also spent in writing notes.
Right. Or talking to the patient's family. Mm-hmm. Since COVID has started, we haven't had a lot of visitors. So we've had to kind of stay in contact with family members so they know what's going on with their family member that's in the hospital. And yes, writing notes is a large chunk of our time as well.
We also spend a lot of time working with other team members in the hospital. So talking to the nurses and the social workers and
physicians in different departments.
Yeah, other physicians, cardiologists, nephrologists, lots of different people.
Right.
Which brings us to some of the skills you need to have when you're a doctor.
So obviously, book smarts, intelligence, able to learn from a textbook or learn from lectures is very important. But something that's even more important, some would say, probably is your interpersonal skills. So being able to communicate with your nurses, being able to communicate with people that are working in different departments or are consulted on your patients.
And let me tell you, it's important for the job, but also in trying to get the job. So when you go through lots of interviews and dealing with people, your teachers, your professors, they will test and see how good your soft skills are. Can you make eye contact? Can you work as a team?
Can you talk about absolutely nothing?
Can you communicate? Yeah, right. So those are really good skills to have. And when you interview, you want to arrive early, always for your interviews. Most of our interviews require a suit.
Right. So there are a lot more things that go into being professional on the job or having, quote, soft skills. So there are a lot of things that go into just your application for residency or a job in general. So like drug testing, background checks to see if you have any kind of criminal record or any legal issues, as well as getting references from people that you've worked with before or that you've interacted with in the medical community.
These are all important things, and being a physician requires you to have good integrity.
Right.
So if this is a decision you're going to make, start making that today.
Right.
Yeah.
I mean, and you should be making that decision as you go along as well, whether you want to become a physician or what you want to become, because it's going to be harder to get a job. I mean, if you present yourself poorly or make poor choices this early. So kind of what you do, you think it may be early right now, you're just in the 8th grade, but everything you do today kind of sets the stage for your future.
For sure. One of the last things they want us to talk about is kind of what would you do differently on this path. So I didn't go from 8th grade to high school to college and then straight into medical school. I had a large gap where I worked and did a lot of different things and did a lot of traveling. And I think that was good for me. Not everybody does that. I know, Dr. Buck, you went straight your whole...
Pretty much, yeah. So
straight through.
I went like 8th grade, high school, college, and then I had like a 6-month break before I went to medical school. And then now I'm in residency. So I kind of look back and think maybe I would have liked to do something like you did. Kind of like get out and live life, experience different things differently than I did before. Maybe just like a time away from schooling and things to just see how things would have made me different. But.
And then sometimes I'm like, well, I wish I would have just gone straight through and not had this gap. So I feel like no matter which way you go, you just make the best of it. Mm-hmm. But it's just things to consider.
And that's another thing to consider too, is there's not just one path to get to medical school. I mean, everybody in my medical class was, kind of a big range of ages and different backgrounds and previous lives, basically. So, there's not one way to skin a cat.
For sure. But definitely, if you feel passionate about helping people and making a huge difference in your community, I definitely recommend pursuing becoming a physician. I love my job every single day. It's something new. It's something different. It's challenging. And you have a blast doing it. And I work with some of the best people in the world.
Right. There's never a dull moment.
Never.
At all. I don't know if you guys have contact info for us or if you have questions, but someone can definitely get you in contact with us one way or another if you have any questions or anything else you want to ask or know about being a doctor. And hopefully we can get in contact with you and help answer those.
Absolutely. Just let us know and we'd love to hear from you.
All right. Thanks, guys.
Bye.